Hello everyone, and welcome. I'm excited to kick off today's presentation with episode 10. This is our opening slide, so I just want to say how glad I am to see you all here. Today, we'll be exploring some fascinating topics, so let's get started. We'll briefly go over what you can expect from this session, including key insights and takeaways. But for now, let's dive into the first part of our journey together. Let's consider this scenario. A 68-year-old client has experienced a right-sided brain attack, or stroke, and has been admitted to the hospital. As nurses, our role is to plan effective care that promotes recovery and prevents complications. So, what are the key points here? First, understanding the effects of a right-sided brain injury is crucial. Typically, it affects the left side of the body and can lead to issues like weakness, neglect, or poor coordination on that side. When caring for this patient, we need to focus on preventing muscle contractures and promoting mobility. For example, using elastic stockings might help prevent deep vein thrombosis, but they don't directly address muscle flaccidity or contractures. Using a hand roll and supporting the left upper extremity on a pillow can be very helpful. This position helps prevent contractures and keeps the limb aligned, which is important during recovery. A bed cradle can prevent the feet from dorsiflexing or curling under, but it's more about protecting the toes rather than preventing contractures. Passive range of motion exercises are often recommended to maintain joint flexibility and prevent stiffness, especially when the patient isn't able to move actively. Connecting this to our overall goal, we want to promote mobility, prevent contractures, and ensure the patient maintains as much function as possible. So, in this case, using a hand roll and supporting the limb seems the most appropriate planning step to prevent contractures and promote comfort. Let's look at the next important step. First, use a hand roll to support the hand and fingers. This helps prevent contractures by maintaining proper positioning. Next, extend the left upper extremity onto a pillow. Elevating and supporting the arm like this helps reduce swelling and keeps the limb in a safe, functional position. Combining these techniques is essential for promoting comfort and preventing long-term complications. Remember, consistent positioning is key to effective care and recovery. A right-sided brain attack, or stroke, typically affects the left side of the body. When this happens, you might notice weakness or even paralysis on that side. It's really important to focus on preventing contractures and deformities, which can develop if muscles stay in the same position for too long. Proper positioning is key here. By ensuring the patient is correctly supported and repositioned regularly, we can help maintain joint flexibility and prevent long-term complications. This ties into our overall goal of promoting recovery and improving quality of life after a stroke. When supporting the affected left arm, it's helpful to use a pillow to keep it elevated and comfortable. This simple step can make a big difference in preventing swelling and promoting circulation. Using a hand roll is also beneficial because it keeps the hand in a functional position, which is important for maintaining normal movement patterns. By doing this, we help prevent flexion contractures and joint stiffness, which are common issues after injury or surgery. Keeping the joint properly aligned is crucial because it reduces the risk of deformities and discomfort down the line. And of course, maintaining good circulation through proper positioning supports healing and overall arm health. This approach is effective because it addresses multiple concerns: comfort, function, and long-term health, all while aligning with our goal of promoting optimal recovery and preventing complications. Let's clarify some common misconceptions about preventing muscle issues in patient care. First, applying elastic stockings is often thought to prevent muscle flaccidity, but actually, their main purpose is to prevent deep vein thrombosis. They help improve blood flow and reduce clot formation, not directly affect muscle tone. Next, using a bed cradle might be mistaken for preventing dorsiflexion of the feet, but in reality, a bed cradle is used to prevent plantar flexion, which can lead to foot drop. It helps keep the sheets away from the feet, maintaining proper positioning. Then, while passive range of motion exercises are very important for maintaining joint flexibility, they aren't the most specific or essential method for preventing contractures early on. Proper positioning and support are more targeted strategies to prevent contractures in the initial stages of care. Now, why are these other options incorrect? Because they don't address the primary goal of preventing DVT, foot drop, or contractures effectively. Instead, they might be helpful in other contexts, but for the specific issues on this slide, these are the key points to remember. Now, let's talk about the importance of proper positioning for stroke patients. It's absolutely critical to ensure the affected side is well positioned to prevent complications. When we talk about contractures, edema, and long-term disability, these are all issues that can significantly impact the patient's recovery and quality of life. Proper positioning helps to maintain joint flexibility and muscle length, reducing the risk of contractures forming. It also promotes better circulation, which helps prevent swelling or edema. Most importantly, consistent and correct positioning can make a real difference in preventing long-term disabilities by supporting optimal recovery. So always remember, as nurses, our role in positioning is a key part of the overall care plan to promote better outcomes.